The innate intelligence or the innate wisdom of our body is literally functioning the way our bodies were designed to function. But because we live in an environmentally stressed out place, or we breathe weird air, or we eat crappy food, or mom did, or mom's mom was adrenally stressed, and that just got passed all the way down, and now we are totally depleted, even just when we're born. So we have all different stressors that we even come in with. So when we can build that back up, we have the ability to regenerate, not just degenerate.
If we look at the body like this brilliant, innate being, right? Even when we talk about like survival of the fittest, how does the body just know that it's supposed to rest or that we need water or to increase my heart rate when I need to run away? The fact that we even have a fight or flight response mechanism is brilliant. And we didn't have to think of that, or we don't have to tell our heart to beat or to change or to do all these things. We just do it. And AK really just allows us to look at that vitalistic philosophy. Like, the body is brilliant, so how can I support its brilliance?
So many patients are looking for is true holistic care. So many people are seeing their physical therapist or chiropractor here, and then they're going to a talk therapist here, and then they're working with a dietitian, and none of them are talking to each other. And so I think that's kind of like the silver bullet for so many patients, is they can come to one place that really addresses the whole person.
So let's just say you're driving in your car and your check engine light goes on. And you're like, man, that is annoying to look at. And it's just like really annoying. But you're like, whatever. And you keep driving, but you keep looking at the check engine light, and it's really annoying. So you're like, oh man, forget about this. I'm gonna pull over, and you get out and you lift the hood and you cut the little wire to the check engine light because it's annoying you, right? Because that's what we do, don't we? We just put a Band-Aid on something, or man, I have a headache. I'll take some Advil, or whatever you do, right? To just kind of cover up the symptom. It's annoying. And then we get in our car and we keep driving, but what's gonna happen? I mean, there's something wrong with the engine, okay? So likely you're broken on the side of the road. Now, by the time you get to the place where your car is broken on the side of the road, you now have to call for assistance. You still have to get that darn engine fixed. Now you've got to get the wire that goes to the check engine light fixed. There's so much more energy and time that goes into what needs to be fixed. Who wants to do that?
There truly is a lifestyle change. You're not going to come here 2 or 3 times and then you're done and you're not going to come back. Because it's more about our constant reminder. We're always going back out into the world and getting thrown all these curveballs, and it's really easy to get taken off course. You need that safe space, and that's what this is. It's the reminder, it's the place you come to get rebalanced, to refresh, to rejuvenate, to help your body and your nervous system remember which direction you should be going, so then you can go back out into the world and deal with all the chaos that's out there, because it's always going to be there. And I think we're kidding ourselves if we think that we don't need support when we live in the world we live in.
We need to be looking at our health preventatively and seeing providers to keep us healthy and maintain health, instead of the traditional Western medicine model is to really just seek out care when we're like on fire, essentially, right? When it's almost like so far gone, it's so much harder to build back, versus just like the preventative care is really where it's at.
One of my mentors used to say, I think most people don't know what it's like to feel amazing, right? If you ask the general person on the street, they'll say, I feel good, I feel fine. But what if we could wake up and feel amazing? And I think that's the difference of people really taking an investment in their health, is they're just happier, healthier people. You have more joy and resilience and thriving in life because you don't have all these extra stressors. So when we are able to really take an invested look in our own health and increase our capacity to handle stress and minimize all of those extra stressors in our life, we do feel amazing.
But if someone's in turmoil and they've been off balance for God only knows years, let's say, it could take a while before it begins to regenerate. Sometimes cells forget how to even be optimal. So it's been in this degenerative zone. So it's like detoxifying, rebuilding, nourishing. Now it's regenerating. Now 13 months from now, every single cell in your body gets to turn over in this regenerative cycle where you literally grow up younger.
I just had an annual physical with my MD doctor, and I was thinking yesterday where I would be if I hadn't met Dr. Cari. And I would probably be experiencing high blood pressure, probably high cholesterol, probably would be 30 to 40 pounds heavier than I am. If I look back at when we met, I was 30 or 40 pounds heavier, and my lifestyle and choices we're leaning towards that, but really understanding the impact, not only of what you add, but some of the things that you may need to take away. And finding a balance in there, I think, has helped me live a healthier life for sure.
Its fundamental philosophy is called the triad of health. So you can see there's a triangle up here, okay? I want you guys to think of it almost more as like a pyramid though, like a 3D structure, okay? And so there's basically 3 different areas of our overall health and wellness that all need to be equally balanced, right? Think about a pyramid. If one side collapses, what happens? The whole thing, right? Can't stand.
This place is like an oasis where you can listen to yourself, follow your intuition, and have the doctors guide you because your body knows what it needs. It's in your cells. To me, I know there's the pyramid of the structural, the chemical, the emotional, but to me, it's all emotional.
Repeat after me. I'm okay.
I'm okay.
Without sugar.
Without sugar.
You can't say it. Keep saying it.
I'm okay without sugar. I'm okay without sugar. I'm okay without sugar.
Okay, let that go. Let's check the concept of fear. Let's check the concept of paralyzed will. So paralyzed will is like you don't have a choice. It's like, I can't do it.
Yeah. Like I'm gonna be, this is the rest of my life. I'm gonna try really good to be healthy, and I'm gonna fail. I'm gonna try again, I'm gonna fail.
Like
And
that's
the voice-
eventually you're gonna end up feeling.
Right.
How does stress affect us on a physiological level? I mean, it's huge. It totally depletes us. It affects our sleep. It affects our digestion. It affects how we function in our everyday life on every level.
An AK gives us the best tool to address all of the stress that's being impacted in our body and the best toolbox of how to deal with it and how to increase our capacity to handle stress and minimize or eliminate the stressors that we're exposed to.
Emotions are energy in motion. They have to go somewhere. And if they don't, they start talking sideways.
All right, so that triad of health really determines like our root cause issue. So then once we decide, okay, there's a root cause issue, how do we fix it? How do we address it? And that's really where those 5 factors come in applied kinesiology.
As an applied kinesiologist, you're like always on your toes because you're always having to think outside the box because there's no one thing. Like 5 people in a row can complain of low back pain or can complain of headaches, and I've literally work on them so differently, it's incomparable.
I think who's really going to change this is going to be the parents, because they're just not accepting like the steroids and antibiotics and procedures and medications anymore. And so it's really cool to see just the stream of families coming in of like, no, my kid has eczema. I've done my own research. I know that's a gut issue, you know, and how do we fix it?
I notice with my 3 kids compared to other kids, they're very emotionally regulated. They know their bodies. They know when they need help, and the help that they go look for is here at Be Optimal. And I don't think a lot of kids are in that touch of their body because they go to doctors who tell them how they should feel when applied kinesiology asks them how they feel.
I was upset from school, and then we had an appointment with her after, and then I went to her and she gave me like this spray, and you had to spray it on you like 5 times a day, and it made me feel better. It feels like your body just like restarted.
We treat newborns here. You're never too young, you're never too old to experience an unwinding and to ensure that your spinal column, that your spinal cord, that everything is communicating with grace and ease. And it doesn't have to look like racks and cracks. It can be very gentle. On a baby, it's the amount of pressure you'd put on like your eyelid. If you were to like apply a little pressure on your eyelid, that's it. And it makes all the difference for their little tiny nervous systems to open up a space of flow for everything to actually function the way that we're meant to function.
My pregnant moms, I'm like, I want you in here with that baby, like as soon as possible after birth, so we can make sure, yes, their spine is in alignment and all of that amazing stuff from birth can be quite traumatic, even if it goes well, but also to, you know, check in on their body systems, like the microbiome and the gut is so important in infancy on building your immune function and skin health and how you can absorb nutrients and the gut immune response, which then turns to allergy issues. It's just a cascade, and the little ones are a lot easier to fix. They haven't had that long to get messed up.
So my hope is that the future of medicine is, again, giving people tools to know what it is to keep their body in a place not just of no symptoms, but rather to get to a place of health and vitality where they know what it is to thrive. And then when life hands us curveballs and it throws us off, maybe we don't have to drop so hard.
I think it's so important because people are really struggling and really not well, and they don't know what to do. My average new patient I see has a laundry list of symptoms. They're bloated all the time, they don't sleep well, they have an extra 20 pounds on them, their knees hurt, they get headaches. You know, once you get them talking, it's like, this is not optimal, right? Like, we shouldn't feel this way.
I think once we stop normalizing all of these symptoms and start addressing them and then addressing the things that are causing them, we'll have a very different healthcare system.
There are true health care providers out there, not sick care providers, that are invested in getting you healthy.
And this work doesn't come with judgment. That's not what it's about. It's literally to come in and to be able to meet people exactly where they are and to help them go next level, whatever that means for them.
Those seekers that have been gaslit and told their symptoms are in their head, or it's just how it has to be, you're gonna have to live with this is a chronic disease that you're always going to have, that's not true. And there's answers out there, and applied kinesiologists are among the best to help you figure that out and heal.